implementation of the Affordable Care Act in Maryland.
Hi everyone. Thank you for the opportunity to present findings from our study. My name is Oluwasegun Akinyemi. It's a Nigerian name. Senior Research Fellow at Howard University College of Medicine. We have no disclosures. Since the implementation of the Affordable Care Act in the United States in 2010, it has significantly expanded healthcare coverage in the country. And previously, we have more than 20 million previously uninsured Americans that has, since the implementation of the Affordable Care Act, have access to a quality healthcare. A major thrust of the Affordable Care Act policy is the expansion of Medicaid eligibility, which has allowed access to more minority groups and individuals who are socio-economically disadvantaged. Presently, more than 80% of the states in the United States, making 40 out of the 50 states, has implemented this policy in one form or the others. For our study, our major objective was to examine if there's any impact of the implementation of the Affordable Care Act in Maryland, how that affects women presenting with pelvic organ prolapse. We conducted a retrospective analysis and compared two time periods. We have the pre-ACA period, which was defined as the period between 2007, 2008 to 2009, and we have the post-ACA period, which is defined as between the period of 2018, 19, and 20. So we compare patient demographics, we compare treatment patterns, and finally we conducted a regression analysis and determined the predictive probability of a patient undergoing surgery as a management modality for pelvic organ prolapse. Here we highlight a significant shift in the management pattern of pelvic organ prolapse during this study period. You look at the color, the blue color represents the pre-ACA period, and the orange color represents the post-ACA period. As we can see, majority of patients, in fact, close to 80% of these women in the pre-ACA period had inpatient care. However, when you look at the post-ACA period, these women, more than 82% of these women now have ambulatory cases, are managed as ambulatory cases rather than inpatient care. When we explore the insurance trends, we found, as expected, a significant increase in the proportion of Medicaid beneficiaries, women who have Medicare, who now are included in the pool of patients having care for pelvic organ prolapse in the study period. Of course, this translates into having, because the majority of patients in the United States who are Medicaid beneficiaries are minority groups. So, as expected, we have a significant increase in the proportion of these minority groups, which are usually Black women or Hispanic women. Now we have, for example, we have in the pre-ACA period having care, we have 12.5%. In the post-ACA period, this jumped to 22%. In the pre-ACA period for Hispanic was about 2%, jumped to about 5.4% of women having inpatient care. As expected, the first set of analysis shows access to care, overall care, irrespective of the treatment modality. So we also looked at how this affects access to surgery as a mainstay of care for patients, for women presenting with pelvic organ prolapse. And we have that same pattern that we saw earlier with the blue. In this particular case now, we have the blue cases representing pre-ACA period and the red for the post-ACA period. That is for the first part of the of the figure, and that represents patients who receive care as inpatient cases. When you look at the second part, that represents women receiving care as ambulatory cases, and with that you have the green line, the deep green line representing the pre-ACA period, and the light green line representing the post-ACA period. And as expected, we still had a significant increase in the proportion of minority groups, Medicare and Medicaid women having this access to these particular procedures. And also looking at this in terms of race and ethnicity, we have more minority group, more minority women, which translates into having more black women and more Hispanics having care for pelvic organ prolapse. Finally, we predicted the odds of a woman presenting with pelvic organ prolapse receiving either surgery as against conservative options of management. And we looking at this, we have the blue line representing the pre-ACA period, the red line representing the post-ACA period, and we are focusing now on patients who receive care as inpatient cases. And we can see a dramatic drop in the predicted probability, the surgery rate for women who have pelvic organ prolapse having surgery. That means that the possibility of having surgery as against other conservative methods of management of pelvic organ prolapse dropped significantly. And if you look at the figure, it drops across the different race, across each race, insurance type. This same pattern is also seen across the different races and ethnicities, with a sharp drop in the predicted probability of a woman with pelvic organ prolapse receiving surgery compared to not having other conservative management in the post-ACA period. In conclusion, our study highlights the significant impact of the ACA, showing a higher proportion of patients who are minority groups, who are patients with Medicare or Medicaid insurance having more access. It also highlights a significant drop and a shift in management from inpatient care to ambulatory cases, and also a shift towards less invasive management for pelvic organ prolapse in the state of Maryland. Finally, the future research, we would like to conduct what we call a difference in difference analysis, where we compare states which have implemented the Affordable Care Act with states which are yet to implement those the policy, to be able to be sure that our findings are actually attributable to the implementation of the Affordable Care Act and not due to other unmeasured factors in our study. Thank you. I'll be happy to answer your questions.
Thank you. Very interesting outcomes. Any questions? Yes.
Thank you very much for this interesting presentation. I have a question about the change between inpatient and ambulatory surgery. You talked about this affordable insurance, and this change, could it also be related to standard of care? In my country, for example, where the insurance has been the same for like 50 years, and we saw the same change from inpatient to ambulatory without change in the insurance system. So could it be related to standard of care really, and not to this insurance?
Thank you for your questions. Like you said, yes, there's a possibility that the changes that we are seeing as a result of improvements in technique, and also, but like I said in the last part of the study, if we do a difference in difference analysis, we will have a state that implemented the policy compared to another state that did not implement the policy. And if we have the same pattern, then we will not be able to attribute this to the implementation of the Affordable Care. That will simply be improvement in care generally. But because that is not what we did here, it's difficult to categorically say that our findings are as a result of the implementation of the Affordable Care. It could be because of improvement in care, it could be because of improvement in minimally invasive surgeries, it can be because of a general shift in payment pattern where ambulatory care cases are more
have more reimbursement for insurance and so many other factors that could actually account for our findings.
That's great. Well, thank you very much. I would like to